wanted to review the bunionectomy portion of my surgery. I had a Chevron bunionectomy done on my first toe and on my last, a small one here. My surgeon does the incisions on the side rather than on the top. So that's one of the reasons why I chose him. And if you want to keep your range of motion, you have to do physical therapy. I'm doing my own at home. It's easy, and I wasn't offered any other option, so this is what I'm doing. But I was given instruction and all that, and I will share that with you, and maybe it'll help you in yours. But basically, it's not the center, not the tip of the toe, but the base of the toe. You take your two fingers here, and you just pull forward. You do this for about a minute, and then release, and then put in the opposite direction with just two fingers or one finger in the opposite direction, like so. When I first started doing this, I didn't even have this range of motion. I mean, I was doing like that. That's as far as I could get it, and now I can do it that much. And it does feel uncomfortable when you first do it, very tight, especially after doing this one first and then going to this one. It's you're like, oh my goodness, I don't know if I could stand that. But if you can stand it, keep going. It's worth it so that you can fit into your shoes. Otherwise, your foot's going to stay like this, and you're only going to be able to wear a flat shoe. But if you increase your range of motion, which is naturally, the way your foot's supposed to be, you'll be able to wear a heel and so on. I will tell you that my surgeon shared with me that when I've done my left foot, he goes, when you go in to get your right foot, chances are with my patients, what I normally do is I take the foot that I first worked on, and I actually take the toe and I yank it forward, because most of the patients don't actually take care to do the therapy, so they sort of let it go, and so he does that to help the patient. So I told him that I probably would not be wearing high heel shoes for the rest of my life. I probably have foregone them, and he told me that that was probably not a good idea, that wearing a heel is actually helpful, a comfortable heel after surgery, so that way you would have that shape of the heel and your foot would get used to the range of motion. So before I ever had surgery, months before, I went out and looked for the most comfortable shoe I could find that was in a heel, and this was it. I got this at Old Navy last summer, and I have not worn it. It's brand new, and this is just fleece material. It's just what sweatpants fabric would be. And this same thing here. I thought this would be great because my incisions, it would be very gentle on my incisions, nothing pressuring them. This is very flexible, but it would give me that great curve on my foot. So part of my therapy, I'm on my 13th week, and I probably would have done this sooner. I would recommend doing it sooner, but I had something else done on my foot, brachymetatarsia, which is a whole different story. So I actually have to start doing my therapy now in this regard. But so I do advise, if you talk to your doctor about this, and maybe they can suggest the same thing